You probably want to know a little more about some of the items that are part of your basic daily routine and what to look out for every day. Your temperature. It should stay below 101 degrees. Also, your weight should be stable. If you gain more than 3 pounds in a day, you could be retaining too much fluid. Keep a record in a calendar or a log. Medications.
A lot of medications that you take after open heart surgery have to do with keeping your rhythm stable, keeping your blood pressure stable, and it's important that you understand how to take the medication and that you take the medication correctly.
When you're taking about 8 different kinds of medicines, it's hard at first to keep them getting mixed up.
Make your own system to remember what to take and when.
We sat down and made up a chart and put the dates and the time down on that the medication was supposed to be taken, and I followed this specifically.
I have a pill box that has dividers for 7 days of the week and then 4 time slots during each day.
You could also use a calendar to mark down which medicine you took and when.
Since I live in a 2-story home, I divided my medicines in half, and I left half upstairs so that when I got upstairs I would have medication, and also I brought half downstairs. Just put it in a baggie and put the label that comes on the outer bag when you buy a prescription inside the baggie so you knew what it was and that other people knew what it was in case of an emergency.
You may, at some time during your recovery, feel like your heart is beating fast or feel a fluttering in your chest. Don't worry. Call your healthcare team. This can be treated with medication. Eating is critical. You will probably not be very hungry your first days at home, but do eat something regularly. Some people find eating small but frequent meals works better for them. What can you eat? Basically, anything you like during your recovery, unless your doctor tells you otherwise. Just don't add salt. You can easily make your own meals as long as you don't bend, reach, or strain yourself. Don't open a new jar for yourself, for instance, or lift anything over a few pounds. Ask someone else to help you. Regardless of the kind of heart surgery you've had, as long as you're on pain medications, don't drink alcohol. Constipation is a problem after surgery. To help eliminate the problem, you can drink more liquids, eat more fiber foods like whole grains, fruits, and vegetables, stay active by walking and moving, and take a stool softener that is usually prescribed.
I was instructed to watch my incisions very closely. If they were not healing properly, I was having seepage, or I was having too much redness or streaks, then I was supposed to notify my physician.
It's normal to feel a little numbness around your incisions, especially if the mammary artery was used for a bypass graft. This numbness will gradually fade. Keep your incisions clean and dry. Inspect them daily, and don't apply lotions or antibiotics directly to them. If you still have staples, take a sponge bath using mild soap and water to clean your incisions. If you have steri-strips, shower as usual. The strips should fall off by themselves. If they haven't fallen off within a week, gently remove them yourself after a shower. You don't need to apply new ones. Watch for a lower leg and ankle swelling if a vein was removed from your leg.
I had a little problem with my right foot swelling when I do a lot of walking, but that's normal for the operation on the leg.
Swelling should go away the more you exercise and elevate your feet.
I would sit on the couch and I would put my leg up on the back of it, get it up higher to get the pressure off of it, and it seemed to help a lot.
At night, put 1 pillow under your head and 3 or 4 pillows under your feet. If your saphenous vein was removed, only wear loose-fitting white cotton socks to prevent infection. During the first week home, go up and down the stairs just once a day. Every week, you can add another flight of stairs to your routine. Only do light household chores if you feel up to it, but no bending or straining. And don't lift anything over a few pounds, including small children and pets. You should exercise a little more each day.
But each day I could do a little more, and that was great.
The walking that I was doing daily, they told me that I should go at as normal as possible pace.
If at any point you feel pain or shortness of breath that doesn't go away with rest, call your healthcare team right away. To avoid extreme heat, cold, and dampness, walk inside your home or have someone take you to a mall or shopping center to walk. Scheduling rest is just as important as scheduling exercise. If you walk for half an hour, rest for about the same amount of time, and elevate your feet. Rest doesn't mean sleeping. In fact, you should eliminate napping altogether. Feel free to see any visitors you like, but know that your tolerance is still low and that you may tire easily. It would probably be better to see visitors in small groups. But do get out of the house. Have a friend or family member drive you to a mall or out to lunch. Every time you leave the house, take a piece of paper that lists the name of the hospital where you had your heart surgery, the names and phone numbers of your surgeon and cardiologists, and your current medications. Should you have an emergency while on a trip, this information could be vital.
I wear a medical alert tag in the event of an emergency, and the medical alert tag indicates that I'm on Coumadin. I wear it around my neck, and so if anything, God forbid, happens to me, then all I have to do is call the 800 number.
It's fine to go on car trips. Just be sure to take a pillow to cushion your chest, and always use your seatbelt. Make frequent rest stops, getting out of the car to stretch. A note to heart valve surgery patients. You may notice a clicking sound depending on the type of valve.
You will hear the valve when it's very quiet, or if you're in bed or sitting and there's nothing else going on, you will hear the valve, and that's a constant.
The clicking is not a cause for alarm. It's the sound of your new valve opening and closing. A special note for Coumadin users. Once you're home, it's important to have your blood tested within 3 days. Coumadin is a powerful drug that keeps blood from clotting. Therefore, you should take extreme care to avoid any activity that can cause bruises or bleeding. Bleeding can be very severe. Use an electric razor and take care not to cut yourself. If you do cut yourself, take care of the cut quickly and call your health care team if bleeding doesn't stop. Take your Coumadin medication at the same time each day and at the same dosage unless otherwise directed by your doctor. Because aspirin and ibuprofen also affect blood clotting, don't take them without a doctor's permission. Also, if you're taking Coumadin, avoid eating foods high in vitamin K, such as kale, spinach, and broccoli. To review, here's your special concerns checklist. Have you reviewed your discharge instructions? Are you weighing yourself every day and writing it down? Are you taking your temperature twice a day and writing it down? Have you set up a system to know if you're taking your medications when you should? Have you stopped adding salt to your food? Are you exercising a little bit more each day? And if you are taking Coumadin, have you had your blood tested 3 days after you left the hospital? The first few days home, call your cardiologists and primary care doctors and make an appointment with each one for a visit about 6 weeks from when you get home. You may want to know when you should call your surgical team.
One of the really important things, if you do have any questions, is not to allow it to develop into stress or anxiety. You need to have those questions answered quickly. You're going to feel more comfortable. So we want you to feel free to call the hospital and use the numbers that we give you as resources.
Don't ever worry about asking a question. It's much more important that you seek the help and get it if you need it than worry about whether the question was not necessary.
While you can call for anything that's on your mind, call your healthcare team if you notice any of the following: a temperature of 101 degrees or greater, a weight gain of 3 pounds or more in a day, if you become short of breath and it doesn't go away after rest, if your heartbeat is rapid or irregular, if you vomit, if your incisions redden, swell, or start to drain, if your chest bone clicks or